Dimitri Karagas, ERA1 alum and co-founder of a company called 30 Madison. We're using telemedicine to change the way guys treat hair loss and migraines and everything like that. It's no secret, I think, that healthcare is a fascinating space today. And over the past couple of years, I've seen a lot of startups in this space, and I was particularly impressed by our next CEO, who brings a unique combination of experience across medicine, business, and tech. Tembo Health is using telemedicine to tackle a huge problem in the geriatric specialty care space. So I was actually so excited that I'm participating in their current round. Maybe you all should too. So please join me in welcoming Dr. Anurag Gupta.
Good morning. I'm Dr. Anurag Gupta. I'm a trauma physician and I'm the CEO of Tembo Health. Our mission is to improve health outcomes for seniors using telemedicine. I'm excited to report we've already treated over 1,000 patients using telemedicine in nursing homes. This is my grandfather, Paul. 4 years ago, he almost died while he was in a nursing home. This happened because he had no access to his specialty doctors to manage his heart failure and his diabetes. It was through his experience that I came to learn that nursing homes only provide access to primary care physicians. This is a huge problem. And it impacts all of us. It could be your dad or your grandma that end up in a nursing home next. And unfortunately, more than 90% of nursing homes across the country can't provide access to the specialty doctors that their patients need. It's a national crisis. Medicare is spending more than $20 billion a year on preventable, unnecessary hospital visits. The problem is driven by logistics and supply. Transporting seniors is hard, and we have a physician supply crisis, which is growing by 500%. This is why many of you wait weeks to months to see a doctor today. Imagine what it's going to be like in 10 years. The solution is telemedicine, which allows us to provide high-quality care to patients in all locations. Further, telemedicine drives efficiency, allowing doctors to treat even more patients. So you might be thinking, technology? Seniors? What's this guy thinking? Well, at Tembo Health, it's as easy as watching TV. As a doctor, I know how critical it is to access patient data. Sorry about that. I know how critical it is to access patient data, and we've built proprietary technology that provides our telemedicine doctors with better access to patient data, allowing them to work faster and smarter. The time for telemedicine is now. Medicare and other health insurance plans are promoting the use of telemedicine. In fact, not only are they offering full payments for rural locations, they're offering incentive payments as well. For the nursing homes, it's a no-brainer. Because it's free, at no direct cost to these facilities, we can provide high-quality care, which improves their quality scores and helps keep their beds filled. The senior specialty care market is huge, $50 billion. Right now, we're laser-focused on the $3 billion rural nursing home market. Today, we're providing psychiatry, and through that, we collect about $30,000 per facility per year from the insurance plans. At the request of our facilities, we're adding more specialties like cardiology and neurology. And by the end of next year, we'll be collecting about $150,000 per facility per year, again, paid for by the insurance companies. We've proven product market fit. We have 4 current clients operating in the state of New York. We currently have 7 signed contracts, which puts us at an ARR of about $200,000. We're on track to be in 20 facilities by the end of this year, generating an ARR of $1 million. And our pipeline supports growth up to 150 facilities by the end of next year for an ARR of $20 million. The demand for our services is so high. We just launched in Texas a month ago. And within our first 3 weeks, we received our first signed contract. The margins are healthy. On doctors, it's about 50%. And as we add nurses and nurse practitioners, that jumps to 70%. In our day-to-day clinical operations, we're building the world's largest geriatric database. We'll be able to partner with health insurance and pharma companies to drive value in personalized medicine. Let me rephrase that. Today, we have an awesome telemedicine business, and tomorrow, we'll be able to harness analytics in geriatrics just like Flatiron did for cancer. Let me tell you about our world-class team. John's our engineer. He's built our entire tech stack and has expertise in machine learning databases. Tanya's running operations. She's helped scale multiple startups, including Oscar Health Insurance. I'm CEO. For the past decade, I've been leading business and technology teams at places like BCG and Imogen. I'm also a trauma physician. You can find me on some Saturdays at Mount Sinai's Trauma Center here in New York. But I hope for your health I don't see you there. Going back to my grandfather, 4 years ago, we had to pull him out of the nursing home to get him the care that he required. If we hadn't, I might be in this picture alone. But I'm really happy to report that we FaceTimed this morning. He's doing well. He's 92, and he's thrilled about Tembo Health. With the rising demand for senior specialty care, telemedicine is the solution. I'm Dr. Anurag Gupta. We are Tembo Health.